Good evening, everyone. I didn't realize my mic was muted. Anyone around? I'm waiting for Sir to join. As soon as he joins, we can start with knowing what hypnotherapy is all about. So I am, hi Tripti, hi Ganpati, hi Manjeet. So I am certified hypnotherapist and I have learned it, but I don't practice it professionally. And who better to talk about it, I thought, to introduce the modality to all of you than the sir I learned it from. So last time when he came on my channel, he spoke about family constellation, which is a very interesting modality. I think I really believe in it a lot. Like, given the choice, I would probably do that for every small thing. छोटी सी कोई प्रॉब्लम आई, फैमिली कॉन्स्टलेशन करके देखते हैं ना क्या है. हर बार तो बहुत सारे, and it's fun to do. So anyway, so today I have, before I learned hypnotherapy, उससे पहले मैंने खुद अपने लिए मैंने हिप्नोथेरेपी सीखी. क्यों? क्योंकि मुझे नींद की प्रॉब्लम है. मुझे बचपन से नींद नहीं आती, तो कम आती है, जल्दी खुल जाती है. चिड़िया जैसी नींद है, एकदम जरा सी आवाज हुई नींद खुल गई, गहरी नींद नहीं आती. तो मैंने सुना था कि हिप्नोथेरेपी करने से you can put yourself to sleep. So मैंने इसलिए हिप्नोथेरेपी सीखी. लेकिन हिप्नोथेरेपी सीखने से पहले मैंने no, I can't see you. No, wait. Okay. Oh shit, I forgot to send him the link only. Invite link ही भेजना भूल गई मैं सर को. And he's saying कि 1 second, just hold on. So मैंने इसलिए हिप्नोथेरेपी सीखी. लेकिन उससे पहले, हिप्नोथेरेपी सीखने से पहले actually there are many modalities that we can use in the SSR case also. The number. So the reason I learned hypnotherapy was because मुझे नींद नहीं आती थी. लेकिन उससे पहले क्या हुआ कि मुझे कुछ सवाल चाहिए थे, मतलब जवाब चाहिए थे कुछ सवालों के. There is nothing that I'm not doing. हल्दी, तुलसी, सुहागा, काढ़ा. I'll show you. गिलोई की गोलियां, ये रहा गर्म पानी, अजवाइन, काढ़े वाली चाय. Yes, you can see your past. So I needed answers for some things, some certain things. And मैं गई किसी हिप्नोथेरेपिस्ट के पास. तब मैं इनको, सर को पता नहीं जानती थी या नहीं, मुझे याद नहीं, बहुत साल पहले की बात है. हाँ, सर को जानती थी, बट आई डिडंट नो कि वो हिप्नोथेरेपी सिखाते हैं. नहीं, मैं अभी 1 घंटे पहले बिल्कुल ठीक थी, कोई खांसी नहीं, कुछ नहीं. अचानक दोबारा वो सूखी खांसी पता नहीं क्यों उठ गई है. तो इसमें हल्दी है, तुलसी है, गर्म पानी है, बट it's not because of that. I think it is the pollution. It's too much of pollution. I don't know, sir का link click करके join क्यों नहीं हो रहा है? Let me just call him. So हुआ क्या कि मैं अपने सवालों के जवाब जानने के लिए हिप्नोथेरेपिस्ट के पास गई. उसने मेरे 2-3 पास्ट लाइव्स मतलब दिखाए मुझे. फिर उसके बाद मेरी तसल्ली नहीं हुई. आज मुझसे किरण ने पूछा था मेरे टेलीग्राम ग्रुप पे, अरे इतना लंबा ब्रेक ले लिया, 1 महीने से ब्रेक पे ही हूँ, so that you know I don't have to talk so much. सर क्या हुआ? I sent you the link. हाँ, no, हाँ, okay, all right, okay. Hi sir, welcome. So let me just complete what I was saying. So मैंने गई मैं एक हिप्नोथेरेपिस्ट के पास और उन्होंने मेरे 2-3 मेरे पास्ट लाइव्स वगैरह दिखाए. उसके बाद मैं उससे पहले एक्चुअली मैं सर के पास गई थी और मैंने इनसे कहा था कि जो भी हिप्नोथेरेपी में आया कि मुझे इस सवाल का जवाब क्यों नहीं मिल रहा. तो फाइनली मैंने ही आंसर दिया, क्योंकि हिप्नोथेरेपी में आप खुद ही आंसर देते हैं कि मुझे कम से कम 20 लाइव्स देखनी पड़ेंगी सही आंसर जानने के लिए. अब तक मैं मेरे ख्याल से 8-10 तो देख चुकी हूँ. तो 1-2 सेशन इनसे कराए, 2-3 सेशन उससे कराए. उसके बाद लास्ट टाइम ऑल्सो आई स्पोक अबाउट एमॉक्सिसिलिन, एरिथ्रोमाइसिन. 2 कोर्सेस कर चुकी हूँ मैं एंटीबायोटिक्स के. राइट नाउ आई एम ऑन अ कोर्स ऑफ एंटी एलर्जी और कुछ भी नहीं हो रहा है. सो एनीवे, तो एक और फ्रेंड है, उसने मेरे 1-2 सेशंस किए. एंड योगेश सर, आपने अपना नाम वैसे कौन, क्या हो गया? हेलो. So I don't know. Okay. So oops. So then हिप्नोथेरेपी में बहुत सारी बातें जब मैं सीख भी रही थी, सर ही मेरे टीचर थे, इनसे ही सीखी हूँ. और हम जब सीखते हैं तो उसके दौरान बहुत सारे practice sessions करवाते हैं सर हमसे. So we did a lot of practice sessions during those 10-12 days of hypnotherapy that I learned from him. I did it for people did it on me. So a lot of things came in the front which I was not aware of. मतलब मैं सोच भी नहीं सकती थी कि कुछ ऐसा है मेरे दिमाग में. तो खैर, it is a very interesting modality, and the best part for me was past life regression, which I did lots of them. So let's hear it from him. Sir, welcome. That is Dr. Yogesh Vasandi. And he's going to tell us about hypnotherapy. You want to say something, sir? Hello.
First of all, it was really funny. You didn't send me a link. I was sitting on YouTube and listening to your story. So I'm thinking, when is Ginny going to call me? Okay, so you were actually mesmerized with your own story. You were hypnotized with your own story.
नहीं सर, एक्चुअली क्या हुआ that I was on another live on Sandeep Fogart's channel, and I was trying to get in that live to say something. और वो मैं इधर घड़ी देख रही हूँ, उधर उसको देख रही हूँ, इधर घड़ी देख रही हूँ कि मुझे वो कब एक्सेप्ट करेंगे. बहुत टाइम लग गया, उन्होंने शायद कमेंट्स नहीं देखे या जो भी हुआ. एंड देन आई हैड टू रश बैक. And it totally slipped my mind that afternoon I was going to send it to you, but then I thought कि मैं शाम को भेजती हूँ, भूल गई. होता है बुढ़ापे में.
So hypnotherapy is very good for retrieval of memories, memory enhancement. So one of its greatest use is that. So we do it for students, for memory recall, and to improve the performance in studies, where they say we study but we can't recall, you know. So before we begin, how much is the time that is allotted for our talk today? So we can structure our talk.
As much as you want. You don't worry about the time. जितना
No,
आपको
it's not a
चाहिए
question
आप
of worry. People have commitments, no? Others who are listening. So we
yeah.
can
So
structure it in such a way that we
ideally,
complete it, and after that we can continue as long as we wish.
yeah. So ideally, uh, I think the attention span of people is definitely not more than 40 minutes. So if we can, cover whatever few important questions, and if you need more, it's perfectly all right, as long as we are covering the uh, topic properly. And after that, of course, we can continue. Log to aate jate rahenge. They will go do their thing, then come back, join back if they want, if they find it interesting, of course.
Yeah, Gini, I'll tell you something which is very interesting that we say attention span is 40 minutes on an average for a person. Yes, that is for a lecture. But when you are in an
Acha.
interaction or you're doing something interesting, there is no
Hmm.
lack of attention span. You see a child who hates studies can't sit for 10 minutes, but when he's playing a video game, he can sit for 6 hours without talking, without food, without anything.
Yeah.
So it all depends on your interest levels. If you're doing something that you love, then you lose the concept of time. You actually go into a hypnosis. And that's what we're going to probably talk about. And as you told me earlier that it would be question based, so it's great because it's a huge science. We are not here to
No,
teach
you
you
can,
hypnotherapy, right?
of course,
But
I wanted
the
to
idea
talk.
is to
I,
understand what it is. So if you can tell me what you have in mind, I can go accordingly.
Thank you, Yashwant. So it's not necessarily that it is question based, but I have a few questions on my mind, which, as a layman,
Okay.
although I've done hypnotherapy, but as a layman, somebody who doesn't know about hypnotherapy, would definitely have that question in their mind. And if they have yet not thought about it, then my first question is, what is hypnotherapy? When did it suddenly happen to somebody? When did somebody really think of using hypnotherapy or hypnosis as a treatment or a healing method? Why did they do it? How did they do it? And how, when the moment I say hypnotherapy, people think about hypnotism. आंखों में आंखें डाले और वो क्या बस बस में कर लिया. So there is a difference between the two. So these are the first two
Very
points.
good.
Thank you, everyone. Thank you, Ganpati. Thank you, Munjit. So, sorry, sir, बीच बीच में thank you बोलते रहूंगी.
This
मेरा
this is what
परसों Sunday था, तो people are wishing me. That's why. Hello.
so can I speak now? Yeah.
Yeah, of
Can you
course.
hear
I'm
me,
waiting
Gini?
for you. I
No,
can.
I just stopped because you were wishing some people. So, this is a
No.
very beautiful question that you asked, and we get asked this question again and again. Such a beautiful science. Why it is not as popular as it should be, though it is popular, is because of this very fact, the question that you put. I'll tell you, I was in a medical college. I just resigned few years back, but I taught more than almost 25 years. Yeah. I was attached to the hospital, earlier teaching full time there, then went to the OPD teaching. Now, I was assigned after I joined the Hypnotherapy Institute to a hospital where the lady was practicing on certain people a new therapy which was called as chelation therapy on heart patients who could not afford bypass surgery or patients who were not wanting to go for bypass surgery and they wanted to try something else for whatever reason.
What
So
what
she said, I have
what
2%
therapy did
failure
you
rate.
she was practicing? What therapy did you say she was practicing?
Chelation therapy. So, what they do, it's like which you use for your, plumbing when something gets choked up. So, to remove the chokes from the blood vessels of the heart, they used to put something inside which would remove or reduce the choke and the symptoms would go away, which the same thing a surgeon does by bypassing that blocked artery. They open up another channel. Okay, so she had this 2% success failure rate, and she said, why don't you try hypnotherapy since you all are saying you all need opportunities? Okay, try on my failure cases. And I was deputed by my institute where I was practicing and learning from. The doctor also, it will be easier for you to mingle and speak with them. So you go there. And I went there on deputation, and it's so amazing. First day I was there, I was finding it very funny, and I didn't know what's wrong. Also, I felt, I don't know what's wrong. It's a sixth-floor hospital. There are nurses, there are doctors, but I'm finding it funny. I have cases, I'm practicing, everything is okay there. And then I realized after 2 days, nobody was looking in my eyes. All the doctors and the nurses were not looking in my eyes. And then I realized what is happening. My teacher had taught that people feel that somebody will look into your control away, make you do things which you don't want to do. And all those myths about hypnotherapy. And then what I did was I told all the doctors there and nurses to come into the conference room. I need urgently. I told the owner, she said, okay, fine, we'll call a meeting during lunch for 10 minutes. And then I told them about what is hypnotherapy and the difference between clinical hypnotherapy and hypnotism. So in Hindi, there is a word called as sammohan. Sammohan is hypnosis and vashikaran is hypnotism. Now, hypnotism is in India by under Drugs and Magical Remedies Act banned. But clinical hypnotherapy or sammohan is approved medical associations in the government if it is taught by a recognized government institute. And people can practice it. Of course, there are terms and conditions to it. And then I told them what is the difference between the two. And it's quite amazing. Now, hypnotism is Eastern hypnosis, or it is also called as Vashikaran in India, is commonly practiced by tantrics and, of course, many other people also who know, though it is banned, that works on mind control. And that's why people are scared because people thought that even clinical hypnotherapy is same, though it's not same. If it was same, why would it be approved by the medical associations here in British Hypnotherapy Association, American Hypnotherapy Association? Why would it be offered in hospitals? Because it does not work on mind control. It works ability of your conscious mind to go into the subconscious mind. See, conscious mind is 10%, where the logic and the thinking and the reasoning is. And we most of our lives are using that for day-to-day activities. But then why is the subconscious mind there, which is 90%? And the Cardiac Math Institute in Pennsylvania, USA mapped, and they found that it is 9 times bigger, but it is 6 times more powerful. And it is like a field which is all around you. They were able to map all this. So then why is it there? And that is where to prominence after 1960 when Dr. John Kappas came and he explained how it works. So the myth is that nobody can look into your eyes and take control, especially clinical hypnotherapy. I wish I could be in front of ATMs and not doing any work. Just look into people's eyes and ask them to give the money and forget about it. So that clinical hypnotherapy does not work on mind control. Deepest clinical hypnotherapy trance that you are in, you can open your eyes, you can walk out, you will come to know lots of things from your subconscious mind under that session. But what to say and what not to say. So you can actually lie under hypnosis there. It's not a truth serum that people feel. And that's why under hypnosis, if people have given statements, they are not acceptable by law as evidence. Even law doesn't take that as evidence because it's under hypnotherapy. You can lie, you can manipulate, though you will become aware of many things. So clinical hypnotherapy is nothing but realizing yourself. So let's try to understand the definition. Then it will become easy. There's a beautiful definition which was given by one of my teachers, Rushi Kumar Pandya. He said that it's a psychophysiological state. Now, psycho means mind, physio means body. So, it's a state which affects the mind and the body. It's a normal, altered state of consciousness where you are in a state which is like sleep, but you're not sleeping. It's a state where you're awake, but you're not fully awake. So it is a transition state between sleep and being awake. You're fully conscious, fully aware, you're 100% alert, you cannot be taken advantage of. And it is characterized. How do you know you're under hypnosis? Oh, body feels very relaxed, pain sensations are less, you become very alert. The thing is that you become highly susceptible to suggestions. That means what you would have not listened to another person, you will at least consider it. So hypnosis is a psycho-physiological state which is similar to sleep but not sleep, which is similar to being awake but not awake, but an in-between transition state, which is characterized by muscle relaxation, peace of mind, and more susceptibility to the oncoming suggestions from the other person. So that is what exactly hypnosis is. And that is what a therapist does, tries to get you into that state where you open your mind so that you can take some suggestions which you can't take otherwise. I'll give you one example that will make sense. Let's say worldwide, hypnosis is used big time to give up smoking. So people say, I want to give up smoking. I don't want to eat sweets. I want to exercise. But doc, I can't do it. So I'm giving myself suggestion. I don't want to smoke, but my mind doesn't accept it when I see or I see somebody, smoking, and that's the odor of the fragrance of the tobacco comes into my nose. Then I feel like I must go for it. And same thing happens with sweets. Same thing happens with exercise. 2 days, 3 days, I do it. Later on, I don't do it because my subconscious mind is not accepting that suggestion. And a hypnotherapist will help you put that suggestion into your subconscious mind, which is 6,000 times more powerful. So you have 6,000 times more chances of accepting the suggestion that I don't want to smoke, I want to exercise, I want to give up sweets, etc. etc. And of course, there are many areas where it is useful. So, what do you think?
There is a problem with your network because you are cracking and freezing every few seconds. Your screen is freezing and your voice was cracking in middle couple of times. Are you on
Really? Because
Vodafone
my
network or
network
something?
shows full here.
Okay. Okay.
I'm on
So that is
Wi-Fi,
Pallavi. That is
but let me check
exactly
again.
that is exactly what Sir was explaining just now. The difference between hypnotism and hypnosis. That is exactly what he just explained. That in hypnosis, which is legally not, which is not legal, people just look into your eyes and they hypnotize you, and it's just that one look that is called vashikaran. And hypnosis. Now he hasn't yet explained how that became a therapy module and who came up with that and all that. But hypnosis is not where somebody looks into your eyes. Hypnosis is where you will, in fact, be asked to lie down or relax, in a reclining chair with your eyes closed. And he will give you commands which you are like, you will be completely in your senses. Yes, you can. There is something called self hypnosis that he teaches. You can do that. So you are in complete control. Whenever you feel, you can just open your eyes and walk out of the door, and the answers will be coming from you. It's not like he is tapping into your subconscious mind and telling you what is happening in your past life. If you all have seen that movie Kudrat of Vinod Khanna, Hema Malini, and Rajesh Khanna, that exactly what Vinod Khanna does in that for Hema Malini was past life regression. But for everything, sometimes we don't need past life regression. Hypnosis is used, hypnotherapy is used for various other reasons and areas of application. That is exactly what he's going to talk about. For example, a friend of mine could not give up smoking, and I'm talking about, say, 15 years back. And he went to London. He found out there was a hypnotherapist who would cure it. He went there, one session, and till date, he's not touched a cigarette again. That is how powerful hypnotherapy can be. And of course, I will allow Sir to continue with it. तो सर आपने ये नहीं बताया कि ये किसने शुरुआत की, इसका इन्वेंशन, डिस्कवरी जो भी है, किसने किया, क्यों किया, कैसे हुआ?
Okay. Hypnotherapy is a very old science. It was known. Okay. In fact, 4,000 years before Christ, the ancient Sumerian writings, which are the oldest writings, they mention about it. Not only
Oh,
that, there are tales of sleep. In Aesculapius has mentioned that. In fact, the ancient Persian magis, then Hindu fakirs, Egyptian witch doctors, they used to use the hypnosis big time. In fact, they used to do the something called as a fixation technique, which we use even now. They would keep a shining piece of metal and tell person to stare there. People who had that time epilepsy and all these things were not curable. So they would tell them to stare, and then they would give suggestions to the mind. And that's how it used to work. So it was known long time back. In fact, so many people mentioned. In fact, in around 1735, there was a doctor in Austria called as Franz Anton Mesmer. In fact, from there the word came mesmerism, to get mesmerized. It comes from the name of a doctor, Franz Anton Mesmer. And he actually studied all these shamanistic sciences. Then he put it all together, and he would keep, an oak tub where there were shining pieces of metals, water in it, fluid, and lights which were shining inside the tub. And the patient or the client who had a problem was made to sit and stare inside, and told, if you stare here and there, then we'll not do your treatment. So you have to continuously stare there. So it was a fixation technique, shining lights, and there were some iron rods which would come up and down in that oak tub, and the light would keep on blinking, shining, and all around there was darkness. And then he would come in flowing robes with theatrics, with drums, and he would use magnets to heal these people by giving hypnotic suggestions. So it has been written, it was there long back. And then, of course, slowly after Mesmer, there was Dr. James Braid, who was told to expose this science that this is bogus. Then he later on became the biggest proponent because he thought that it is working. He gave the name hypnosis. It comes from the Greek word hypnos, which means lucid sleep. It is a sleep-like state. And then there was Dr. Bernheim. There were so many army doctors who used to use it as anesthesia, especially in armies. When there was no anesthesia, they would use hypnosis as anesthetic agent to do amputation operations so that people and soldiers would not feel the pain. And by World War One, we had fantastic research for removing the post-traumatic memories of soldiers who had seen the war and people who had seen the war. It became very successful science. Then 1960, Dr. Kappas came, and then it got all official recognition. Textbooks have been written, and it was known since a long time. Our Hindu texts also mentioned Sammohan. No, Sri Krishna was known as Sammohan. He used to do Sammohan. That's why his name is also Mohan. Are you able to hear me? Or is it still
Yeah,
freezing
yeah,
and
yeah.
cracking?
I'm
My
able to
network is
hear. Yeah,
full.
yeah.
Yeah, my network is quite full. Yeah.
Yeah, yeah. I'm able to hear you. I was muted. So I remember once in class, you had told us about a man who had some cancer or something, and through hypnotherapy, you had cured him. He had altered his DNA or something like that. Remember, in hypnotherapy, he told you about that DNA. So tell us that story.
I really don't remember that story because these are not my words only. Because it's very important, and I want to categorically tell here in this audience and everywhere that I say hypnotherapy is a complementary science. It is not to replace the medical system. It adds on to it. It's an adjuvant. It complements the treatments that you're taking so that, yes, the symptoms, your illnesses, your diseases have a psychic component. So, especially in psychosomatic disease where mind is associated with your bodily illness, it can reduce the mind effect. And yes, maybe your medicine's requirement may reduce, which your doctor will provide. But when you're taking hypnotherapy, you are not supposed to stop any medication. You have to listen to the medical doctor advice. Here we'll be working on your mind component of illness. So this is very important. So in cases of cancer, also we use, because cancer has got a history of, there is research of which is now showing that there is long-standing suppression of emotions which leads to cancer, right? So there are many. You see, as human beings have evolved, we have learned to suppress our urges. Now, suppose I want to sit here in my pajamas to give the lecture here or to give this talk. I don't do it because socially it is not acceptable and it's not nice. So I'm suppressing that emotion. Slowly over the years, we have been suppressing our emotions because we can't be every time ourselves because we want to live together. We are living in a society. There are certain rules. And as the rules of living increase, the suppressions increases. And as the suppressions increases, research says the more you suppress, it comes in form of illnesses. And this is where the beauty of hypnotherapy comes, where you can actually help release emotions in a safe environment
Sir,
of the
since you
mind.
talk,
And
since you since you talk about emotions, suppression of
yes, go on.
emotion, and all of that, kindly also briefly can you explain that it is emotions and suppression of emotions that causes health problems, how and why? Since you spoke about it.
Okay. Okay, let me give you one example. Then it will be easy. Otherwise it's very theoretical talk. Um, let's say you want to shout at somebody, you want to scream at somebody because you're very angry, you're irritated. Let's say it's your boss. Okay, and you have taken an EMI, you have taken a bank loan for which you have the EMI for the next 15 years, and this is the job that you need a lot. And now the boss has actually touched the wrong part, the wrong nerve of you. He has actually
Control.
stimulated that part of you where you want to actually pounce on him and kill him or her. Okay. Now, will you normally do it when you need to pay that EMI and you're sensible and logical and in normal state of mind? We won't, correct? So what happens to all that charge and that anger and that irritation? It remains inside. Now, normally after that, what happens to that person? Guinea, can you tell me? Suppose you want to scream, shout at somebody and you did not do it. What happens to you later on?
I knew you were going to pick this up. Cough.
Okay, so people. So okay, let's not make it very personal. So uh, many times people will say, I get a headache, I just felt like, or I go out and I break a thing. Yes, if they break a bottle or a glass, it's good, the thing is gone out. But what if they are not allowed to do that, that it is impolite, these are not good manners, etc., etc., and they keep it inside and they're kind of clenching their teeth tight, and sometimes they get a headache, some people get a gastric, some people get whatever, some symptom. So this is
Migraine.
classic where migraine, yes, very yes. So migraine, they say, comes when you are unable to take a decision which you know you have to take and it is good for you, but you can't take it. Let's say a woman says, I really don't like the husband, and I'm not in love with him, he's not in love with me, but I cannot break the marriage because I need the finances. Now I'm not used to working anymore, and what about the kids? What will the kids feel? Kids need both the parents, etc., etc. So she knows she has to take a decision which is right for her, but she's not taking. Very classical candidate to get migraine. So, like that. So, suppression of emotions leading to physical problems is psychosomatic medicine, and lots is written about it. You can just Google on the net. In fact, there's another good
So,
author you can read and Google on net is Greg Braden has written a book called as Divine Matrix, and the other author that you can really see his videos, and I really like him, is Bruce Lipton, Dr. Bruce Lipton, Biology of Belief. These are two people you should Google, and you'll be surprised at how our lives are actually revealed by these people through research.
so biology of belief is by which author? I'll
The
just write
Biology
it
of
down.
Belief by Dr. Bruce Lipton. Yeah.
Bruce Lipton.
Belief, Dr. Bruce Lipton. Like Lipton tea you have? Lipton,
Huh, that's what I have.
Lipton.
And
Bruce
what
Lipton.
was the other book that you spoke about?
Another book is called as Divine Matrix.
Divine
Divine
Matrix.
Matrix
By
by Greg,
Greg.
Greg, Greg
Greg
Braden, Braden, Braden.
Clayton.
Just check
Okay.
the spelling. I'm not sure of his surname, but Braden is the how we pronounce it.
Okay. I just wanted to write it down here. That's why I asked. So, one sec. So, everybody who's watching here, if you have watched my earlier video, my live on chakras, you remember I told you that the person who had come to explain all the major chakras and said, if your chakra is blocked, then in that part of your body, you will have issues. So, why does that happen? It happens because of emotions. So, it's the same thing. application is the same. It's because in that part of the brain, the confusion or emotional or mental thing in the brain, uh, in the third eye chakra or the crown chakra, so the person will get a migraine. If there is something to do with the throat chakra, you'll get a cough. So that is what, that's the reason I asked him to say, talk about it. Please continue, sir. ये भी आप ही से सीखा है.
I'm sorry, your video is cracking and freezing. I'm unable to get your question, Guinea. Can you
I
repeat?
said continue. Continue.
Okay, so there are various areas of work in hypnotherapy. It's a great complementary science, and as an adjunct to the normal treatments, various therapists incorporate hypnotherapy along with the other therapy. It's a great finishing therapy, if I may use the word, along with other diagnostic therapies and diagnostic psychology. If we are able to combine this as a finishing therapy, it's amazing. In fact, in 2002, Government of India allowed this in a government resolution, in a general resolution, that this therapy can be used by practitioners for various purposes. And there was a list of 168 areas where they found that it is definitely documented that it gives results, whether it is fears and phobias, whether it is anxiety removal, whether it is for people who want to meditate. I really use this big time for people who say I can't meditate or shut off my mind, or it is for sleeplessness. Hypnotherapy has been proved beyond doubt as one of the great remedies to overcome insomnia. Then addictions, we all know it is very good. There are specialists, hypnotherapy specialists who work only with addictions. So you can try that. It is very good for performance enhancement. In the gyms, there are people who say, I want to go beyond this, but I'm not able to go. So for performance enhancement, it is good for students. We help people, 10 standard people to overcome exam anxiety, to improve their memory recall. Of course, you have to study. Only that can be then brought back. So memory recall, removing of anxiety, pain management, it is very good. Preparing a testimony, a witness for testimony, a person who gets very nervous going to court and he has to give a testimony there. So we prepare the witness. It is used in the sexual field. It is used for stammering. Very good. It is amazing for recalling memories of the past when you're forgetting. But because our subconscious mind is nothing like the hard disk of our computer, and it has got various memories which you have forgotten, but that is affecting your behavior unknowingly. For instance, you don't know why I'm so scared of a cockroach. Why am I reacting to a cockroach as if it is a hungry lion? Logically, I know it cannot eat me. Logically, I know I can take a shoe and push it away. I can take a broom and push it away. But I scream, I shout, my heart bursts, I start sweating on my palms, my eyes become big. It's like a sympathetic overreaction that happens. Sometimes people go into panic mode. So these reactions, which are out of proportion to the stimulus, can very well be handled with hypnotherapy. Of course, there are many, many other applications. In fact, I would really like, Guinea, if you could take some questions of the audience if they are sending you on the chat.
Yeah,
So
I've,
then it becomes more like, to the point and
yeah.
focused on that.
So
If you think that's a good idea.
when you speak about memory, that includes past life. So somebody asked a question that if you can do regression, can you also do progression? Somebody up there asks that question.
Yes,
I will just
yes,
flash.
yes. So subconscious mind is a repository or like the hard disk of your computer, which has got all your memories. Now, if you believe in reincarnation theory, then you can go into past life, you can go into the memory of the womb. If you do not believe, no problem. Goes into right till your childhood, all the memories that are there are present in the subconscious mind. Now, future progression is creative visualization, which is also one of the great usages of hypnotherapy, where you can visualize a future that you want to have. Because hypnotherapy is based on this belief that what you perceive, you cannot achieve. Now, if you don't believe you can be, let's say, a person who earns 10 million, then you cannot earn. But if you believe you can, then that can be programmed in your mind. And of course, you have to put the effort along with it. And if something is coming in the way, there are nothing but blocks which are allowing you to go beyond a certain point, or to achieve or to put that effort, that can be tackled very well with hypnotherapy. So future progression, yes, it can be done. Dr. Brian Weiss has written so much about it. So, but many times more than future progression, people are more into wanting to know why this has happened to me. So they like to go into the past more. So we do more of regression work rather than progress. Of course, we end the therapy with a good progression, but you go with a good feel also.
Okay.
Hope that answers your
Next,
question.
next question is, what if we want to remove bad memories or negativity from our mind? Is that possible?
So first of all, let's understand the concept that no memories can in the mind be deleted. Many people come to us, delete those traumatic memories of the past. This was a bad happened to me in my childhood. Typically, a girl child who comes in, girl who comes and says that I'm having problems in my relationship, and this I think is because of the some abuse that happened in the childhood. Somebody did wrong to me or whatever. Can you please delete those memories? No memories can be deleted from your subconscious mind. But yes, the emotion associated with those memories, which is causing this problem, can be released. And that emotional charge, when it is released, you are able to look at the same event with less of a reaction and you're able to move on. But yes, it cannot be deleted.
Okay. How does this therapy help people to fight depression?
Okay, now see, depression, you must understand, for a psychologist, depression is a diagnosis which comes after series of tests. For a lay person, we use the word depression very loosely. Life sucks, I'm feeling low, etc. These are the terminologies which people use, okay, and we also call them depression. Now, referring to, if talking to the layperson's depression, yes, hypnotherapy can definitely help. But if you're talking about clinically diagnosed depression, clinical psychologist after psychometric testing, then it requires medical therapy, it requires and it requires hypnotherapy if you wish to, along with it, which will speed up the recovery of the person.
Vishnu has asked, medication is needed for hypnotherapy. No, medication is not needed. Um, should progression
So
be done rather than
hypnotherapy is
regression?
a non-invasive science.
Is it a good idea to check on your past lives?
Guinea, I cannot hear you. Your voice is trailing off in between.
I said, is it is it a good idea to see your past lives? Can you hear me?
Okay, so let me be very honest with you. I can hear you, but your video is freezing a lot. But doesn't matter. I got your
That's
question.
happening on my end
So
also.
let
That's
me be very
exactly what
honest with
I'm.
you. When I learned,
Hello? Hello?
you were saying something, so I stopped.
No, I didn't say some things. I don't know. There was some other noise.
Okay.
Hello? Network is really bad today. Hello? So, continue, please.
Yeah. Okay. So let me be very honest with you. When I started my hypnotherapy practice, I'm talking about more than 15 years back, around 12 to 15 years. I would take anybody who wanted to see a past life. Okay. Because, of course, I wanted to really get my skills better and also earn good money. It's a very paying science. So I would take anybody who was curious to see a past life. Yes. And whether you believe in it or no, I would tell them one thing, that doesn't matter, even if you do not believe in it, you still, what if it is a figment of your imagination? This was what they would keep asking me. What, doc? This may be just a figment of my imagination. Yeah, I would tell them, yes, it is. Let's
Even I
assume that
asked
it
you
is a
that.
figment of your imagination. It is giving you rich metaphorical insights which are helping you to go further in your life and be happier, then it's worth it. You don't need to believe in it. Because now I practice in an area, that part of Mumbai, where there are communities who do not believe in theory of reincarnation. And yet they come to me for past life regression, and you can see. But again, remember, only 2 to 5% of cases need past life regression. And of course, now I'm talking about 15 years back, and now we have so many modalities which you can use instead of past life regression, and you can bypass that and still work on yourself. This is not the only way to heal yourself. Only 2 to 5% of the cases actually ever require it. There are other cognitive ways to deal with it also. There are other non-hypnotic ways to work with it also. So you can choose. Today we are so lucky. We have so much choices available for us.
Right. Ganpati asks, can we perform hypnosis in a home to cure ourselves? So basically, self hypnosis.
Sorry, I didn't get your question. Your voice is cracking.
Can we perform self hypnosis at home to cure ourselves? Can you hear me?
I can't hear you. No.
Network is bad. Self hypnosis. Can they do it at home?
Okay, I get your question now. Okay, so I think one of the best things, even if you do not want to learn about hypnotherapy, you don't want to be a therapist, a great thing to go in for self hypnosis. You can learn that. There are 3 to 4 hour modules on it. It's now taught even online. I also teach it as well, but many people teaching it. A good certified practitioner, you should learn it from them. You can do it on your own. Again, it is very important to understand that you get CDs and tapes online of self hypnosis. But sometimes I think, self hypnosis means you should be hypnotizing yourself. How can somebody else's voice hypnotize you? Then it is no longer self hypnosis, it becomes hetero hypnosis, somebody else hypnotizing you. Huh, you can read the script in your own voice, tape it, and then listen to it, then it becomes self hypnosis. Self hypnosis is very easy. I think it's one of the most wonderful sciences to learn to overcome your sleep issues. Secondly, to be in a peaceful state of mind, to meditate, to say within 1.5 minutes, you can just relax yourself. If you are relaxed, you are able to take better decisions and you are able to overcome your problems, finding better solutions. And of course, there are many benefits as you do self. It takes 1.5 minutes to go into that state, and it takes around 3 to 4 hours to learn it. It's an amazing science. Please do go ahead. I invite you to learn self hypnosis. There are many around who are teaching it.
Read the question on the screen. How many past lives can affect our present life? Read it if you can't hear me. The question is
Lives
there on the
can
screen.
affect our. I
Present
am
life.
on the phone, so I'm not able to read because the font is very small on the screen.
Okay. How? So basically, past life karmas affect our present life, is what she's asking. Past life
Oh, that's a huge
karmas.
topic. In fact, I do karma management workshops. I got your question. I got your question. So, in fact, I conduct a workshop on karma management, life purpose assessment. So, this is actually my forte. But it's a huge topic, too big to discuss here. But yes, if you believe in reincarnation therapy, I mean theory, then obviously karma and the other concepts which are there associated with it will come into play. And obviously, if you believe in reincarnation, that means something that you could not achieve, could not finish, you're coming to finish or achieve that time. This also is karma also thing, but balance. If you see the meaning of the word karma, it means balance. It also means unending knot. That's the funny part. Karma means unending, not never ending story. And that's why we are into a karmic cycle of life after life. So there are a lot of good books written. You can go through it on this topic. But yes, uh, you should go into hypnosis only if you are interested in it. Go clear your confusion. Go there for enrichment, because otherwise, chances of you getting more confused are very high if you do not have a mentor and a guide to take you into this journey. Yeah, it's a big science. It's a big science. So maybe
Okay.
go slow on it. And whether it is tied to past karma, I would suggest, focus in the now, be in this life, sort out cognitively the issues of this lifetime first, use your skills there, and then move over to past life. Many people use spirituality as an escape route to run away from the reality and not resolve the problem and say, this is my past life karma, so it's going to be there, so it cannot be sorted out. No, it's not true. Karma has a lot of myths. We have a fear-based association with karma. Karma is an amazing science and a concept to understand. It has no fear in it. It's a concept to be understood. It's not an eye for an eye as we think. It's much beyond that. But it's too big a topic to discuss here in such a small time,
I
right?
think next time we'll do a video on
But
your
yes,
karma
and karma
theory.
are.
If you wish, we can do a video on karma theory next time. So, just now, what you were talking about, that you need a mentor. So, somebody has asked, can we have a 7-day retreat session with you? Retreat session with you.
Sorry, a
7 days.
retreat.
You're
Yeah, of
frozen.
course. Why not? Why not? Why don't you all? Yeah, question. You wanted a 7 retreat sessions. Yes, we can do that. See, I no longer teach hypnotherapy as of now. I've resigned from the institute since last few years. But yes, I do conduct sessions. And yes, in a retreat, we can plan to have lots of hypnotherapy, hypnosis, etc. to be done on each other. We can plan a retreat. Why don't somebody take up the charge, organize a retreat, and I would love to conduct it for you.
Okay. All right. So, using clinical hypnotherapy, we can get someone at transition stage. Does any impact made in such stage last even afterwards? Using clinical
I'm sorry, Ginny, I am
hypnotherapy,
losing you. I'm just not able to hear you.
same here. Even I'm having that problem here. Okay. Um, what do I do? So, can you explain how you do therapy? I mean, I'm not saying you do it, but a small sample, because somebody asked, can you show us here how it's done? Now, you cannot show, but can you kind of give maybe, can you hear me, sir?
Okay, so from what I understand of your question is, not really, but I'm trying to catch some isolated words. What I understand of question is you want me to share possible, correct? Is that right?
Show. Yes, yes, yes.
Okay, so first of
Yes.
all, online, I do not do hypnotherapy. I do not do. There are some people who claim to do it and they
I am
can,
not
but it's
asking
a
you
very
to.
one-to-one thing that you can do. Group hypnosis, many people do group regression, but the success rate is poor. Okay, we can do a trance group session that can be done, but it's very mild, nowhere near hypnosis. It is nowhere near hypnosis. Hypnosis is a completely different state of mind, which is not like sleep, not like awake, something in between. It's a very subtle state. You understand? And online, and that too, with this kind of connection, I don't think great idea, because sometimes people through certain things, issues or fears because they're own zone. And if they cannot ask me what is happening there, it can create more panic. So I
Yeah.
would not like to do it online. But what we typically do, I can just explain to you quickly
Shall
and it
I?
will give you an idea. When you go to a
Shall I?
hypnotherapist, it takes one session to prepare a person. to break their myths, to make them understand what is hypnotherapy like, how would the state be. Then we give them a primer of hypnosis, and then the therapy
Shall I,
begins in the next second or the third session.
shall I shut this down and start again? I'm calling you. Shall I shut this session down and start a fresh session? Is what I'm asking you.
Yeah, we can do that.
Yeah?
Yes,
Okay.
we can do that.
Okay. You're not answering my question, my call. Okay, so I'm shutting this down here.
Yes, we can
Close.
do it.
I'll start again. Okay. Okay, guys, just give me 2 minutes. I will have to reboot my Wi-Fi. I don't know if the problem is on my side or his side. I will just reboot my Wi-Fi and I will start the session again in 5 minutes. Okay, not even 5 minutes, 2 minutes. I'm doing that. Thank you, sir. I'm coming back.